appreciate it very much. Ephraim, what's next?
Pat, for thousands of COVID-19 and other hospital patients, nurses play a major role. Now, though, with safety concerns limiting physical contact with family, these hospital heroes are playing an even bigger role than ever before. Heather Sells has their stories.
When people go in the hospital, they're by themselves. You know, our patient that we just let out, I mean, he was up there for 20 days without seeing anyone.
Shelby Roberts' COVID unit at her Alabama hospital is always full. A new normal that she describes as trial by fire, and she's not alone. In Virginia, Dr. Jamie Holland, a nurse educator, says she's getting calls from former students at all hours about the strain.
The words that I'm hearing are, "This is awful. This is very distressing. This isn't okay."
A major stress for nurses, personal protective equipment, or PPE. Protocols are constantly changing, and they worry about getting it right.
Now you're putting yourself, not just yourself at risk, but you're putting your family at risk. You're putting your coworkers at risk. You're putting your children at risk.
For some, they're isolating themselves, living in campers and tents to avoid contact with family. On the job, they're trying to support patients emotionally who can't receive visitors. Chelsea McLaughlin is a first-year nurse in Virginia.
Feel that I should, be sure that they're okay, talk to them as if, they were my own family member, try to get their real feelings out.
And part of the job right now is being there for patients who are dying without family. For one patient, Shelby Roberts put her own phone in a plastic bag and got 6 family members on the line.
Just held it up to her ear, and they said their goodbyes, and they prayed with her, and then we all sang Amazing Grace, and I held her hand. We put on the gospel music.
Roberts and other nurses say these are painful yet rewarding moments, and while it can provide family members a final goodbye, this COVID-19 separation can also lead to lingering issues.
We are not only robbed of a loved one, but we're robbed of the ability to gather together and honor them.
According to Regent Professor and licensed professional counselor Danny Holland, this makes it harder to bring closure after death and can lead to guilt. What can be important is understanding that a loved one is just that, loved.
Dying alone doesn't mean dying unloved. It simply means the absence of the loved one being with us in that moment of death.
For many patients and nurses, music is a huge comfort. In Arkansas, nurse Michael Stramiello goes into patients' rooms during work breaks to play worship music or other requests. For McLaughlin, her personal favorite is Waymaker, and she's playing it a lot these days. And she has a message for her patients' families. Please call.
We might not have time to talk to you right then, but we will call you back. We will talk to you. If we can, we will take the phone into the patient. We will let you talk to them. Please call.
Nurses are trained to bring patients and their families together. It looks different right now, and it's not easy, but most would agree it's worth fighting for. Heather Sells, CBN News.